Hi friends, welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time to spending here to learn something new. Today we will discuss about why insurance company will deny the claims. Okay guys, now we will discuss about the reasons. For example, if insurance is denied the claim, what kind of reason they will provide on a EOB, denied EOB. So that kind of reasons we will discuss now. So first I given as a non-covered charges as a reason. So if you will a claim to insurance company, generally the nature of the insurance is to give the payments or otherwise to deny the claim, right? So if we got the payments, okay, leave it. If we don't have the if we don't get the payments and if the claim is denied, then only we will get this kind of reasons. So now we will discuss about non-covered charges as a reason. So they denied the claim with a non-covered charges. So non-covered services happens in a three ways. For example, if it is a non-covered as per under the patient plan, then we will get the denial. So if the service is non-covered as per the provider, then also we will get the denial with the reason. And also if the service is non-covered as per the payer guidelines, as per the insurance guidelines, then also we will get the reason on a denial. So guys, you should have to concentrate how it is a non-covered. It is non-covered as per the patient plan, provider, or either payer guidelines. So non-covered happens as per patient guidelines, as per doctor guidelines, at the same time as per the payer guidelines. So as a air caller, if you are good at analysis, you should have to understand by seeing the reason, then you can understand how it is a denied, because they will clearly mention this is a non-covered as per the patient plan, or it is non-covered as per the provider guidelines, it is non-covered as per the payer guidelines. For example, payer guidelines, if they deny na, they will provide like, okay, this kind of services is not deemed experimentally by the payer. So this is not deemed experimentally by the insurance, is nothing but it is a non-covered as per the payer guidelines. So guys, you should have to very cautious, and you should have to understand the reason with the remark codes, because if the claim is denied, they will give the denied reason, and at the same time they will give the remark code. Exactly, they will give what is the exactly reason on that remark code. So here the next point I given as a referral is required or authorization is required. So referral is nothing but an approval to consult a specialist. So to consult a specialist, patient first will go to the family doctor. That family doctor is also called as a PCP, is also called as a gatekeeper. So that PCP, that family doctor will give an approval to consult a specialist, to consult a rendering doctor. That kind of approval is known as a referral. So if the patient plan is HMO or EPO, if the patient does not obtain referral from the PCP, from the family doctor, without obtaining that referral, he bill the claim to insurance company will deny the claim stating that a referral is required. So if the patient plan is HMO and EPO, it is a better to cross verify whether we obtain referral. And also I given the reason like transcription errors, for example misspellings. For example, date of birth is 1998, it will be given as a 1997. So this kind of things will be also very cautious while you are submitting medical claim to insurance companies. So if it is not correct, then you will get the denial, like this kind of reasons as transcription errors also reason for to get the denial from the insurance company. And also I given like claim bill to wrong insurance address. For example, insurance address is wrong, so at the time you will also get this kind of denials. So by name only we can understand easily. And I given like incorrect patient information, incorrect provider information, and also incorrect insurance information are the reasons for the getting the denials from the insurance companies. And also here I given the reason like mismatched medical codes. Medical code is nothing but CPT code, diagnosis code, and place of service, or at the same time modifiers. And sometimes what happens, the CPT is inconsistent with the modifier. Sometimes what happens, the diagnosis code is also inconsistent with the patient age. So this kind of service related codes or the procedure codes, diagnosis, all those DX codes. So this will be comes under the reason to get the denial from the insurance companies if they are not matched to each other. So mismatching of those codes will also reason for to get the denial from the insurance companies. So, and also I given the one more reason, missed medical records. So for example, if there is no, if every service is given to the patient should be documented in a paper, right? That will be called as a medical record. But so in medical record you should have to submit like what tab, what kind of subject is there, what kind of object is there, what kind of history patient has, what is the previous diagnosis code, what is the previous illness. Every that kind of information should be documented in a paper with a electronic sign, date, and a particular time of that particular service. Everything should be documented in a document that will be called as a medical record. It will be documented by the patient whenever he giving service to the patient. So guys, this, for example, you submitted a claim to insurance company telling that we want medical records, or otherwise we are missing medical records. So this kind of information also very required. So if there is no medical record, you will get the denial from the insurance companies. So guys, if you are watching my video first time, if you're not yet subscribed, could you please subscribe my channel PKR Vibes Career and Growth, and hit the bell icon so that you will get every notifications to your mobile. So, and also I given the reason deductible, sorry, duplicate billing. So duplicate is nothing but, for example, you submitted a claim, so with the same kind of services to the same kind of doctor information, provider information, service information, everything is same to the same payer you submitted. At the time you will get the, like, it is exactly duplicate billing. So if you are submitting claim again and again, also you will get this kind of denial, also duplicate. So, and next reason I given is policy is inactive. It is very easy, and also it is very cautious, because if policy is inactive on particular date of service, because the service is taken on today, for today the policy is inactive, at the time you will get the reason policy is inactive. So insurance is very the nature of insurance is to give the payments, or otherwise completely they will deny the claims. But as a caller, as a AR caller, or as a uh, job, your job is, as a worker, your job is to working on a denial to make into the payment. As a AR caller worker, your job is working on a denials to make them into the payments. So you should have to verify first, this kind of scenarios came now, what kind of information is required, you should have to analysis on a claim before only. So because analytical skills is very required, because with those kind of analytical skills you can close the claim without calling to the insurance maximum times. So that is what this kind of eligibility denials calls are not required. If you run the eligibility in a proper way, you can solve the claims toward the resolutions. And here I given one more reason primary UOB required. For example, you submitted claim to primary insurance. They tell that okay, we are not the primary insurance. For example, you submitted claim to Medicare tell that 109. Now this may be covered by another payer. Nothing but they are not the primary payer. You should have to run the eligibility, and you should have to find out who is the primary, then bill to primary insurance. For example, if you submitted a claim to secondary insurance telling that primary UOB is required. Nothing but if primary is already paid, that kind of paid UOB you should have to submit to this insurance along with the resubmission. So you should have to submit the claim along with the primary UOB to the secondary insurance. So this kind of reason also required. For example, they deny that okay, primary UOB is required from the insurance. So your job is to submit primary UOB along with the resubmission. So your next thing I given as a reason, maximum benefits exhausted or maximum benefits met. So for example, only 5 CPT courses allowed for this patient. So it was already services taken by the doctor. Five visit course already services taken by the doctor. Then if you bill at the sixth time, the insurance will say that maximum visits are exhausted. Maximum your procedure visits or CPT visits are exhausted. So that is also the one reason. And sometimes what happen, this patient is there, the patient will get the services for the doctor up to $1,000. So on a previous date of services, he already billed the claims, and he already taken the services up to benefits of $1,000. Now he again billed to the same insurance to get the benefits. Then insurance telling that your benefits already met, your benefits already existed. So this is also the reason to get the insurance denial from the uh, payer denials. Friends, if you felt content is useful, could you please like my video so that it will reaches more needy people. And thank you so much for your time. Have a good health. Bye for now.